Hi, I'm Dr. Singhania from Singhania Clinic, and today I'm going to talk about autism treatment. It's important to understand what autism is to be able to help your child. So, autism is many things, but it's basically a social and communication disorder. And a child's social difficulties and communication, not language difficulties, can impact his ability to learn. The treatment is complex and depends upon the age of the child, the level of autism, how much the child can talk and understand, the intelligence level, presence of challenging behaviors, and most importantly, sensory issues. The main principles are we should at the earliest strengthen communication, because once the child learns to communicate either through pictures, signs, or words, challenging behaviors are prevented or reduced. We also need to teach them social skills, especially important skills like requesting, joining in, asking for timeout, etc. Adaptive life skills are very important, and these need to be explicitly taught. Skills like toileting, eating on their own, getting dressed, etc. At all levels, sensory issues must be addressed because children may have a sensitivity to sound, textures, taste, and these will interfere with the child's learning. Similarly, medical issues need to be looked at. So what are the main principles? I have divided it into 5. One is low anxiety and low arousal environment, a structured environment, use of pictures, a lot of pictures and visual schedules, structured teaching, knowing what the child should know what he's trying to learn, and then of course teaching concepts, especially verbal reasoning. What are the strengths these children have? They can understand concrete concepts very well. They can memorize very well. So in fact, their excellent memory masks their inability to learn verbal reasoning or comprehension skills. They can recall visual images and memorize pictures very well. They may be hyperlexic and learn to read at an early age, and they can learn to use concrete rules and sequences, and we have to introduce this in our teaching methods so that they learn easily. What are their difficulties? They have difficulty gaining meaning from their activities. They don't learn from what they're doing. Like I said before, they have verbal reasoning problems, and learning abstract concepts are very difficult. Abstract concepts like before, after, wishing for something, guessing something. They may also have attention problems, organizational difficulties, and they also may be very routine oriented. They may resist change, and so they may not like to change from one subject to another, or they may not like to change the way they are taught. I've had kids who get upset if the question is worded differently and things like that. So what do we mean by low anxiety and low arousal? It's important to reduce confusion and unpredictability. This can be done by forewarning of change. So if there's any change in their timetable, you must warn them beforehand. They must have visual timetables, and the areas should be clearly marked so they know what is to be done in which area. They should avoid general clutter in the room they are being taught. And we have to increase a sense of calm, which means we have to be calm when we are dealing with them. We have to reduce their sensory overload, and we must give them techniques and tools to be able to relax themselves and know when they are upset and need to have relaxation. Structuring the environment is extremely important, particularly physical structuring, and we can use the tapes, colors, table mats, so the child knows that this area is for reading, this area is for writing, this area is for eating, things like that. We also have to minimize auditory and visual distractions. So things like covering the computer when it's not in use, or reducing competing distractions, or covering open shelves are very helpful. We also need to do structured teaching. So using pictures to teach. A task can be broken up into simple steps and picturized so that the child can learn. And the child also needs to be very clearly told what is to be done, and told through pictures, mind you, what is to be done, how much work is to be done, when am I starting, when am I finishing, what will come next. As I said earlier, abstract concepts are very important and very difficult for these children. And what do these mean? What do I mean by abstract concepts? I mean time, relationships, non-verbal communications, they don't take social cues from facial expressions, idioms, all that are difficult. So they should be taught specifically and explicitly, means overtly. So you use visual pictures, you repeat till they understand, you use concrete materials to teach abstract concepts, and even the language you use with them. So instead of saying, "Why did you do that?" you have to say, "I did not like it when you threw your toy down, when I said it's time to eat." So it's always important to be very clear and specific in what we say. If you're seeking help, please contact us through the web or on the email or phone number shown below. Thank you for watching.